Dr. Waldorf, thank you for joining us.
Thank you for having me.
You introduced the Clear and Brilliant device into your practice about 6 months ago. For which of your patients do you recommend the Clear and Brilliant?
The Clear and Brilliant device has been very helpful for my patients who either aren't physically ready for a full Fraxel treatment or who have had a series of Fraxel treatments but really need some maintenance treatments, or perhaps they're not ready for an additional Fraxel treatment. It's great for the younger patients who complain of pores. The 1927 Permea handpiece is the one we use the most, and I find that it's very well tolerated by patients and gives them a sense of a glow or more luminosity. So it's been very well received.
Great. Being that the treatment is more gentle than Fraxel, do you recommend a series of treatments?
I think it's very important to set expectations when you are discussing the Clear and Brilliant with patients. Just as the improvement in volumization is going to be based on the amount of filler we put in, here the patient's improvement will be based on the number of treatments as well as the level of the treatments. Patients come in and expect one to do everything if you don't tell them otherwise. I explain to patients that I expect most of them will require 4 to 6 treatments, so we offer packages of 4, packages of 6, and then we tell people if they want to do more, they can buy another package or then go treatment by treatment. One treatment will definitely improve the softness of the skin. Patients will say that it feels better, but for improvement of pores in particular, as well as some discoloration, I do find that they won't start to see significant persistent improvement until after 3 or 4 treatments. For patients who have had a series of Fraxel dual, with the 1927 in particular, I find that this will help keep their improvement going. So perhaps for that patient population, if they've recently finished the 1927, perhaps fewer treatments will be necessary. Patients will also do best if they are continuing a good topical cosmeceutical regimen. The Clear and Brilliant Permea tip is packaged with several SkinCeutical products. So you do have the opportunity to apply some of their antioxidant products and masks to the patients right after. It's called a Permea because then it improves the permeation of these ingredients into the skin. But even afterwards, patients who use their topicals, whether they're antioxidants, peptides, growth factors, or retinoids or alpha hydroxy acids, will do better than they had done before after having had a series of Clear and Brilliant.
Do you ever combine the Clear and Brilliant with other treatments on the same day, or do you have patients return for those treatments on another day?
The first time I have a patient do any procedure, I like to do that procedure as an isolated procedure, whether it's a laser procedure or a filler procedure or some other device. That way, if the patient has any questions about a reaction, it's very clear to what they're having the reaction. But once they've had their treatments, I frequently will do the Clear and Brilliant either combined with fillers, and in that case I'll do the fillers after the Clear and Brilliant. I will do the Clear and Brilliant at the same time as the YAG laser. Again, I do the Q-switch neodymium YAG laser for the most prominent lentigine, or might freeze or electrodesiccate seborrheic keratoses or sebaceous hyperplasia immediately after the Clear and Brilliant. You could also do treatment with a vascular laser. In that case, I would probably do that before the Clear and Brilliant, rather than having to do it over skin that's quite red immediately after the treatment.
Dr. Waldorf, thank you so much for sharing your time and expertise.